Good day, ladies and gentlemen, and welcome to the University of Kansas Hospital Update Conference Call. I would now like to turn the conference over to your host for today, Ms. Jill Chadwick, spokesperson for today's conference. Please proceed.
Doctors, at this time, if you would please update us on our baby Ashlyn.
Sure. I just came from Ashlyn's room, and she's there with her grandmother. She looks fantastic. She's bundled up, looks like a small burrito. And she looks extremely comfortable, and grandmother's very happy. The other family is out right now enjoying their other kids.
And our first question comes from the line of Bill Briggs, NBC News.
Hi, congratulations on your success and to the family. I just was curious on the sterile surgical superglue, if you could kind of explain the components of that, and aside from the sterile nature, does it essentially have the same adhesive quality that the brand name Superglue?
It is a cyanoacrylate, so yes, the base compound is the same as the brand name Superglue. There are a number of glues in this class, and they all have slight modifications that alter their properties to make them most amenable to the goal at hand, but essentially it is a type of superglue.
This is Dr. Reeves. We use the same type of glue to seal up cuts and incisions as well, so it has a lot of applications for us. The glue that was used in this baby was designed and formulated to be used in a wet environment, so it works while it's inside blood vessels, but the end result is the same, is that it is an adhesive and it seals the blood vessel shut.
Our next question comes from the line of Ann Reynolds, ABC News.
The tool, you were mentioning that this is the smallest you could get. What else is this tool used for, and is it new? I mean, a catheter and a wire this size, is that something that's been around forever and you just didn't use it for this sort of thing, or?
This tool is not new. In fact, I had ordered a newer generation tool that I was hoping would arrive in time for Ashlyn's procedure, but when she experienced bleeding the morning of, I went with the tools that we had. So in fact, we have been using this tool for adult pathologies for a number of years, possibly a decade. Historically, we've had small catheters that were so small that they were driven by the flow of blood to the area of interest. These days, we like to have more direct control over the navigation of the instruments, so we like to apply a little micro wire, we call it, a navigable wire that you can put a shape on, and you introduce this inside the microcatheter, and it allows you to steer to the point of interest through the twists and turns you encounter along the way.
She's had an incredible outcome. Obviously, Dr. Ebersole played a big role. I played a role. There's a lot of other people that don't get credit for this that help us tremendously in our day-to-day work, everything from the operating room techs to the radiology techs to the nurses to the anesthesia department. The pediatric care team has been critical with this. So we played a critical role that, you know, is getting a lot of attention because of her outcome, but really her care here has been 100 different people providing care for one tiny little baby.